Good evening and assalamu alaikum to everybody, and warm welcome to all our distinguished participants for joining us from around the world. And we really feel honored to have today's honorable speaker, Professor Dr. Edris Alam, founder and chief executive, Disaster and Development Organization DADO. This is webinar session number 78, and today we come together to address a deeply important but always overlooked issue. The title is Neglected National Crisis, Child Drowning, a Leading Killer in Bangladesh and Beyond. I kindly request all participants to keep their microphone muted during this presentation. There will be approximately 1 hour presentation, and after 1 hour, 30 minutes question and answer session. Anybody can raise your hand and ask the question after the presentation. Now I request Ragib Niyal Sadab, second year in Computer Engineering Khalifa University, to deliver the short biography of Professor Dr. Edris Alam. Ragib Niyal Sadab, you can start to deliver the short biography.
Okay. Short biography of Professor Dr. Edris Alam. Dr. Edris Alam is the founder and chief executive of Disaster and Development Organization, DADO. Dr. Edris was a professor at public universities in the UAE and Bangladesh. Professor Dr. Edris Alam is ranked among the world's top 2% of scientists based on a citation-based assessment conducted by Stanford University in collaboration with Elsevier. Dr. Edris Alam has studied in Bangladesh, Australia, and the United Kingdom, and earned his PhD in disaster risk reduction from the University of New South Wales in Australia. Professor Alam has successfully secured competitive research funding from governmental organizations, non-governmental organizations, international NGOs, universities, and international development partners, including UNDP and DFID. In addition, Professor Alam has served as a consultant to NGOs, the government of Bangladesh, international NGOs, and United Nations agencies. Professor Alam is an author of 2 books, one on disaster management in Bangladesh, and another is Disaster, Crisis, and Emergency Management in Middle East and North Africa, published by Springer Nature. Thank you.
Thank you very much, Ragib Niyal Sadab, second year student in Computer Engineering Khalifa University, to deliver the short biography of Professor Dr. Edris Alam. Let us now begin the important presentation. Professor Dr. Edris Alam, you are kindly requested to commence your presentation, and good luck.
Thank you, everyone, dear moderator and participant. Good evening. So I think they give a big introduction about me already. So let me start the sessions. So we'll be talking something, I give the title as a national crisis, but neglected one. So through this presentation, you will see why the drowning is a big killer in Bangladesh, but it often neglected in national policies, political agenda, and in other project and the program implemented by the governments and the NGOs and other civil societies. I'll be mainly talking, will be supported by my co-presenter, Jili Rima, who is a intern with Disaster and Development Organization, as well as a postgraduate student in the Department of Geography and Environment, University of Dhaka. I think we should little bit talk about the organization. DADO is established in 2008 as a trust, as a non-profit organization. Now, last 2 years, Disaster and Development Organization is a national level NGO. We are working in Bangladesh over 17 years in a fundamental principle. Mostly, number one, to prioritize initiative that benefit most disadvantaged populations and extend our reach to the remote and inaccessible regions. This means we go beyond the government people or NGOs traditionally who are center in the Upazila or district or even Union Parishad headquarters. I go beyond like the river-prone area, coastal area, along the bank, along the slums area like that. And also we focus on mostly disaster-prone areas. Here is some snap pictures of our works in different areas in Bangladesh. Now let me go to our today's presentations. In this presentation, we'll talk about the child drowning by numbers, key facts, how many child drown in a country, in the Bangladesh, in the globally, their age, sex, who are more vulnerable, their demography, their socio-economic condition, something like this. Then we discuss about the drowning prevention. One, in a word, drowning is not a disease, or it's not something like we cannot prevent it. It's obviously preventable. And we talk about the ABC of drowning prevention. What is the ABC of drowning prevention? Can make the 20,000 child per year die in Bangladesh. How can we prevent that? We talk about the public awareness using strategic communications. We talk about the myth and facts, what we think about drowning, but what is the reality, and what are the activities from disaster and development organization have been taken to prevent drowning, and how can you, me, or everybody in a society can contribute to it. So drowning is the third leading cause of unintentional injury death in the world. So nearly 7 to 8% of death in the world caused by drowning. Annually, 300,000 die, which means 822 per day. It's a global death. The most drowning occurred across the world in 1 to 4 years sites. And one of the top 5 causes of death for people 1 to 14 years. Is the highest cost for the 1 to 4, and then fifth cost for 1 to 14 if you go age bar more often. In Australia, it's leading cause of unintentional injury death, children from 1 to 3 years. In the US, even the reason I'm talking in the global, we think it's not only in Bangladesh, it's globally the same. Second leading cause of unintentional injury death in children 1 to 14. So basically, in even first world countries, it's a one or first or second or third cause of death. 95% of child injuries occur in low and middle income countries. Among the global death, 95% occur in middle income and low income countries. Bangladesh drowning occurred 43% of deaths in children 1 to 4 years. Males are specifically at risk of drowning with twice overall mortality rate of females. We'll talk about why male is more, in a age 1 to 4 face death than female. So globally, it's nearly double. If in 100 death, 50 female, 100 is male. Here is some more facts of drowning in Bangladesh. Bangladesh is the greatest delta, as you all know, water bodies like pond, ditch, canal, lake, river. You know what we say in Bangladesh, you will find in a 2 to 3 kilometer, you'll find something, either lake, either canal, or ditch, or pond. Maybe not one, in a combination of each of these within a 2 to 3 kilometers. Every year, approximately 18,268 children die in Bangladesh, causing 50 per day. Drowning is the highest cost of death in children 1 to 17 years, higher than other causes like pneumonia, malnutrition, diarrhea. Before, pneumonia, malnutrition, diarrhea was bigger, but nowadays, combined of these three, drowning is higher than these three. 80% of drowning among children below 5 years occur in ponds within 20 meters from the family home. বাংলাদেশে মূলত পুকুরে আমাদের যে দোয়া পালা হয়, গোসল হয় গ্রামে, সেখানে কিন্তু পুকুরে আমাদের মানে বাচ্চাগুলি মারা যায়। Lack of child drowning supervision and inability to swim are considered major two reasons. Two reasons for death of children in Bangladesh. Number one is in village we don't have the child care center, we don't have the confined house like in urban. Child when they start walking they roam around the home. We talk more about supervision and death in another slide. Children under 5 years of age, mother being illiterate and being low income status are also considered the facts of drowning in Bangladesh. So every day whenever we see the Bangladeshi news, we see in a breaking news in the always down there, drown child death here and there, and most of the cases you will see two child died at the same time. We talk about this, why two child at the same times later. Drowning is not only a cause of the child, it also many celebrities, many adults, even university students you see face drowning. Few years before, 2 years before, we see the national media coverage for the students from Gopalganj universities. Every year we see our students, even public university students, going to somewhere for the vacations, field trip, excursions to as part of their curriculum. University like the water bodies, recreation areas, either lake, coast, Coxbazar, Kuakata, wherever. So we see the drowning. To my experience in my public university teaching, even private would be more, number is more. Public universities, 70% new people coming from village still do not know swimming. Because how we know, before we take any students from Bangladesh, from university to anywhere, we take their sign, and we have they has to fill up forms. And one question is that do they know swimming? Because we have to keep eyes on them. As you know, anything happen, the university and teacher will be the responsible. So we take that responsibility, and we see nearly 70 to 80% year by year difference. University graduating students, undergraduate students does not know swimming. It's not only university students, lots of celebrity around the world. And I think last year 2025 a pilot also died in Canada, as you know. In some other countries, Bangladeshi we see many times, in Australia, US, our children's face drowning problems. Here is more scientific results from the drowning deaths causes. As a these results coming from the different studies. Place of drownings in Bangladesh, 66% caused in pond, then ditch, khal, nala এগুলিতে 16%, lake 8%, river 5%, other 5%. And in terms of the distance from the house, if you see, most of the drowning occurred 20 meter from house. The pond located within the 20 meters from the house. And regarding the timing, the number one cluster of time is the morning time, 9 to 13. Why? The reason is this is the most busiest period for a mother who is the primary and the only one supervisor in a village home, who get busy for cooking and other washing and family other responsibility. This is the time very difficult for them. Although they keep the child, try to around them, but this is the time when drowning occur. There is also another times is the evening playing times. Sometimes also they face. And another things now we say in terms of the timing is festive drowning. If you see, lots of people go village from urban areas, they lost their child. ঈদে কোরবানে যখন দেশে যায়, they lost their child because family become busy with other things. The child does not know the swimming. They have curiosity about the around area, nice village ponds and things like this, and that times also happening. So it's all we call festive drowning is a big issue nowadays for urban people. And generally, it should be like that. July, June, July, August is the 3 months of higher drowning because of the heat, peak of water. The water level rises, so people's understanding of the risks may be not that heightened, but drowning occur. Why drowning occurring in that level in Bangladesh? Why 18,000? Why becoming a big challenge in Bangladesh? Because we don't have any, number one, national clear central policy for drowning prevention. As well as swimming is not compulsory in school curriculum. As you all know, most of you, if you are in Abu Dhabi, Dubai, or in UK, some countries, swimming is a compulsory. That's to, I heard some university in US, they don't get admission even the child does not know the swimming. In Bangladesh, many children cannot swim when even they leave the primary school. And not only swimming, water safety is also different things, like what to do when a child sees someone to drowning. Do he take to part in rescue or not? Or he shout for someone? And if he try to rescue, what he do? So water safety basic principle is not also clearly included in our education systems. Sometimes the education is not in a way to life oriented. It's more the theoretical. And also requiring isolation fencing around the swimming pool or pond areas. Ensuring immediate resuscitations. PCR, which is needed to rescue when someone drown, how to rescue, number one, and how to give the PCR, most of the people don't know. And sometimes people rescue their child, but they take their child on top of the head and make ground, and all sometimes they take the ashes, সোজা কথা এই খড়কুড়ার যে ইয়েগুলি আছে সেগুলি দিয়ে তারা এই কুকিং এর ইয়েগুলি দিয়ে ওগুলি দিয়ে তারা তেল মালিশ করে, something which caused the drowning as well. So PCR, water safety, these are completely absent. This is coming from our studies. That's nearly in our recent studies, 95% people never heard about that how to give the PCR. Although we're talking about this very painful drowning, it is preventable. Unfortunately, globally, before 2023, 2021, since World War II or United Nations established, global lots of development happened, lots of policy improvements. As you know, United Nations become stronger, WHO become stronger. Unfortunately, drowning was not been considered before 2021. Somehow it was ignored in the global level, but it's preventable. How we can prevent drowning? The global studies, the result coming from the global studies compiled by the WHO, they identified 6 interventions for drowning prevention. Number 1 is baby care, daycare, because in the village, no baby care, daycare around the world. Installing barriers around the water bodies where the child pass away, play. Teach school-age children swimming, flood risk and other hazard managements. Train bystander in safe. So that means also not child swimming, also like adult people, how to they rescue child, we have to teach them. And also set and enforce safe boating, shipping and ferry regulations. If you see in Bangladesh, many people die in the ferry guard accidents. overcrowded boat, engine failure, this kind of things. Most of the times happen during the festive period, Eid and Korban, overcrowded boat, and rainy seasons. Due to the safety, no, you don't find many. 90%, I would say, the ferry guard don't use the life jacket. So that's also a big challenge. So if we prevent that, also can be one good preventative measures. Apart from this, there is 4 strategies to drowning prevention. Number 1 is the multi-sectoral collaboration. We have other programs like the CPP. We have the cyclone management program, flood management programs. We can incorporate drowning problem there. So without another new programs, because government don't want to take the new programs, within existing program, we can bring the drowning preventions. And public awareness using strategic communications. Little bit happening now, like I, through this organization, already initiated some campaigns in Bangladesh. Whenever I go Bangladesh, I try to do something with the school, with the communities, with the Rotary Club, because the Rotary has a very strong networks and all very good high profile people there. So I try to do that to make the aware a body of the people, like same way I'm doing here, to bring this to the agenda of the Bangladeshi community, and establish national water safety policy plan, and more research at bringing into how effectively drowning can be managed in Bangladesh. We have known measures what can be done, but it's always better to get more updated research results. As I promised before, we talk about the ABC of drowning preventions. So what is the ABC of drowning preventions? Globally, we say 3 measures teaching peoples can be very good, effective way of drowning prevention. Number 1 is A for adult supervision for child has to be increased. B for barriers like BERA, fencing around the ponds or other water bodies where the child play or walk. C, classes, CPR or classes, swimming and how to rescue, how to give the CPR to the people. So A is for adult supervision. Let me explain it more. Supervising during non-water activities. It's not only water period, like we mostly see the people supervise children when they learn swimming, but without that period, we should also all the time keep the child supervisions. Children drown without a sound. One thing we have to remember, whenever child drown, it's very silent, nobody know it. So sometimes we think about it will not happen with our family, with me. Whenever I went to village level, in some cases like in Shondip, when I went, I opened the discussion in a tea shop in a embankment close to the coast. I found nearly 10 people was in a tea stall. 7 of them directly see the drowning. Some of them family has faced drowning, and all of them face one or another time drowning challenges in their lifetime. I didn't see anyone say I never see anything, I never face it. They have experience. 60% children who drown in ponds are not expected to be in and around water. So those kids drown in children's, definitely that time they child drown in the ponds, 60% of them not to be there. That means they are not went for there with their parents or anyone to do the bathing. It's unexpectedly they go there. And children should be washed by a responsible adult 100% of the time. They are in or around the water. Supervision is not a partial work. It's not 90% time. It should be 100%. You all, if you hear people with the adult people, you know all how quickly child go under your unnoticed from your sight. It's very quickly there. And apart from this, I know all of you have been talking about the bathtub, buckets, containers. Also, this in Chittagong, I don't know what in other area called Gamla, the before where the cow feeded. That's also one of the place where child drowning occur, because family keep the water there for the cow, but sometimes child unintentionally go there. So even in urban areas, every year you see the news of the bathtub and the buckets in the washroom. Child drowning occurs in Dhaka or somewhere else in other urban areas. So here is the second example of the barriers. So barrier could be effective 5 feet tall, non-climbable. It should be non-climbable. If the child can climb, they'll try. Self-closing, around the pools, around the water bodies. Also, secondary barriers may include alarms and food and spa covers. Third is the playpen. In village, we don't have many family cannot afford the playpens for their child. It is an effective way for the very busy farming or other laborious peoples. That could be an effective, giving them playpens, and install, inspect, and always use barriers. So these are the measures about the barriers. C for classes and CPRs. Provide all children and adults in your family in swim lesson and water safety trainings. Untrained people tend to help others in dangers. This is one of the reasons, as I said, sometimes child even know they don't know how to rescue. They try to see rescue other people, and they directly go to water without any roof and any protective measures. They also face the drowning. That's what, as I said before, in many cases you see one students fell down and another one went to rescue happening. Training allows people to act more safely when performing a rescue. Regarding the strategies, communications, we have the now social media, public awareness campaigns, general population and decision makers, and also behavioral change campaigns aimed at specific communities or risk group. Specific communities risk group here is the village communities, and also in our government lower level administrative tier, they should get the more training to include in their general agenda. I don't know why big campaign happen in Bangladesh political. To be honest, I see here we as the NGO civil society, 10 people, 20 people we can bring in a place. Political agenda bring million people. If they should talk about in a Bangladesh kind of area, they should talk about the safety issues. They should talk about the cleaning, drainage, flooding. We see this kind of things should be their regular agenda, not only shouting and or promising people for the vote and things like this. So it should be all communities, particularly is very much absent from the influential peoples. Now I move to one of the facts, talking about the myth and facts. As I said before, we will be talking about what we think and what is the fact. I think maybe I don't know how many people will discuss about this. We take the questions. How many of you know that drowning is a 20,000, 18,000 child die in a year in Bangladesh, 50 in a day, and also how much confidence you have drowning and what could be the reality. So let us discuss some role-playing exercise. Most of the cases, the myth we think about, it cannot happen to me. I am a good parent. This is number one. Most of the people happen when they are. In my research, result is showing same. I never thought it would happen with me. It never happened with me. I always keep eye on my child. Most of the mothers. So this is normal. Very, very much, but it's false, to be honest. All parents whose children have drowned felt this way. No one believes a drowning could happen to their child or the children under their care without layers of protection. No child is safe from the tragedy of drowning. Yes, it's true. It's not only drowning. Child, if you don't keep eyes full times, supervisions, take care, they face many things. 10 minutes, 5 minutes, if you give them, away. Another myth is my elder siblings are taking care of my child. Many people around me in a village. Another thing is the parents leave their child to the elder one, and also thinks there's many people. It never happened. Not other people looking at always taking care of your child. Yes, they see, they definitely say maybe, but nobody will be taking responsibility of your child protection. So many children die whilst being taken care of elder siblings. Children die in rural Bangladesh, even living with many houses with full of people together. We have to think about we are the main responsible persons for the child safety. Third is the myth is our thinking, we believe my child is safe because he had swimming lesson, but swimming for a child, it's a protections for a child, particularly 4, 2, 5, 6, 7, 8, 9, always not the one to save, because when you teach him swimming, the child may act better, but in the alone, due to panic, the child may not act better. He may not behave the same way when you teach him. So only swimming and leaving him roam around is not a way, is not a enough for child protections. Sometimes he may know swimming, another child go swimming together. That is another things happen in Bangladesh. So one child die and hold another one, they die together. So even knowing swimming is not enough for the younger children. I find many times parents talking, the child was with me, just in a minute he was with me, and I don't know when he gone. So we cannot assume that the child with me, he cannot go outside. The child is always curious outside. They want to explore that age, 2, 2, 3, 5, 6 child always want to explore outside, want to go outside. So, and the toddler, I find this year in Ras Al Khaimah, maybe this month or earlier month, child died in the Ras Al Khaimah. All with the family, all family together, the child died. Because the child moved very faster, very movement. You cannot see in a minutes when where he gone. So unless the child is with your direct side, there is always the possibility he may be in the water. Another thing is I will hear my child if he is in trouble. No, drowning is a very silent event. Drowning children do not splash, cry, or call out for help. And kids drown without a sound. Simple things. When someone fell down in water, they cannot cry, they cannot make sound. Very silent killer. So we finished the ABC and the myth. Now come to the what we can do and what I am doing. I kind of long time overseas, nearly 20 years now. Although I was involved with many things in Bangladesh, but permanently in a way coming and going. But I was panic. I was shocked when I see recently last 2-3 years when I see the drowning problem is bigger, higher in a rural Bangladesh, and also seeing social media sometimes more post coming. And I took this initiative to do something, for drowning prevention. And I think it's 2023, 20 July, I started writing the national media. This is one of the Ittepak editorial, I think. Panite Dube Shishu Mitru, Acti Obelite Jati Shankar. This is the first writing I think I did. And following this, I did lots of social media campaign. I went to the Upuzala level, the sub-district level to the EONU and his team. I went even if you can see that directly to the right one, fixer is the village level, Utan Boitok, people at the time I'm doing Uthan Protocol, people is busy with the national election or something like this, or any kind of elections at that times. And then left side, the Union Parishad. So I know where I need to go. I went to the UNO and his team. I went to the Union Parishad chairman and his team. I went to the village. As a person, I cannot do everything. I try to my visit effectively in a same day. This program sometimes I make 3-4 programs in a same times. So I did from the organization is doing the courtier meetings. We're trying to increase the CPR provider in village, and we're trying to we gave sometimes want to play pen for poor family. I have got approval from the district administration for the swimming gatla in a village fund. It's underway, and we are encouraging people to do the barriers, and we also have a one child care center in village. We take a one pilot. We're trying to increase, and this year I have planned to be a campaign in the Dhaka Press Club. Before I used to do in district level. Now this year I will move, hopefully this July, World Drowning Prevention Day. I would like to do in the Dhaka Press Club with all government stakeholder and the national media. So these are the small efforts from our side. The reason we're talking, I actually initiate this this agenda to the, I know it's an engineering group people, I bring them agenda because I think it's not only 1-2 people or some NGOs or several communities can do it. Should be everybody's responsibility. And the reason I bring this organization to your front, to your help, to your suggestions, how we can bring our diaspora in other countries, in Canada, US, Australia. We'll talk about this next slide. So start by sharing knowledge gain. I believe whoever we present here in participating presentation today, they can share the knowledge with their family. If the no panic, no awareness, not people will take the actions. Check if children are safe from drowning at your home. Share your knowledge and experience with the families, friends, neighbor, and relatives. We talk many things, but we don't talk the important things sometimes. This should be our gossips within our discussions. And also, if possible, I show something. I went to the respective village, Union Parishad and Thana headquarters. I would encourage some other people also following this, they could do. Like Uthan Botok, social media. Whenever I go, I have some pliers with me. I print some pliers. I have some volunteers. As I used to be public universities in Bangladesh, I bring the students with me and they do some campaigning, And if possible, in our village, if someone have a newborn, we can give them gift of like the playpens and other protective measures, and also provide swimming lessons. As we started something, we would like to extend this. CPR training, we can try. You should do it lots in the in person at Uthan or something like this, or ward or Thana Union. But now YouTube has a good resources. We can refer them to the YouTube for the how to do the CPR. I take my two children, two boys at that 3 or 4 years. Within 4 years, they both learn the swimming. Within 4 years. In Bangladesh, sometimes they don't allow the children at 3 in the waters. They wait for 5 years, 6 years. But to be honest, in US, child in 2 years, 3 years, they know how to swim. The age of the swimming in Bangladesh is now 7 years. 7 years. Yes, 7.3 something. We can bring it down. We can bring it like 2, 3 years, 4 years, minimum 4 years. We can bring 4 years. If the 4 years happen, then the gap between 4 to 7, 3 years, that's still happening per year now, it will be reduced. We can do something there. This is scientific studies I'm talking. 7.3 years now, the swimming learning is. But if you can bring it 4 years, so 3 years, those child facing drowning, you can save them. Helping to form youth campaign community. We have now lots of social media. Young people is lots of doing that. There's some volunteer as well. we can encourage them to bring this agenda in their discussion in their annual programs. Establishing child care center in high poverty prone areas, and also research and development is always the key one. So here's the references. We make some scientific studies. We're doing it. We have more on times. So we have now some vacancies in our organizations in terms of the volunteers, interns, research assistants. As I think beginning, I didn't say, DADO is a national NGO, but we are expanding our organization legislative, like in Australia, we already got the charity registrations. We already registered in Australia. We are getting registration in Canada and USA next week. Our registration in done. So that means our diaspora, it could be a global platforms. Bangladeshis around the world, they can join with us as a volunteer. Our generation, like our children, they can come as a intern volunteer. I see my relatives in the US, their children go to the African countries for the internship. They go to stay in the desert area, very far area for the internship from the university. Now we can bring people, our relatives, our children from those countries, from Western countries, from Middle East, they can go to our organization for the internship. So we have this vacancy. You can code, you can barcode, you can scan and see the application form to fill up, and then we can call them for the activities. So we are opening our positions in these countries through the global platforms. I already advertised this to the United Nations platforms. We have a deadlines, and we also have make a dedicated donation phase. We did not have anything before. Same. We through our Australian registrations now we can do the crowdfunding or campaigning social media, because before this year or before coming this registration, everything is managed by me or my team. Now we're trying to give this to the global, all diaspora. So here is our kind of finishing. Now I leave the floor to the audience for your comments. As I said, the presentations, our discussion will be effective. We can, if you can spread this to the friends, families. If we involve some people, if more people are aware, more people come in this type of initiative, then it can make something different together. Thank you, everyone. Thank you.
অনেক ধন্যবাদ প্রফেসর ডক্টর ইদ্রিস। আপনি যেভাবে এটা তো মানবিক কাজ, আপনি যেভাবে মানবিক কাজ বাংলাদেশে করতেছেন এবং এটা ছড়িয়ে দিচ্ছেন বিভিন্ন দেশে, এটা রিয়েলি অ্যাপ্রিসিয়েটেবল। এবং আপনারা সবাই জানেন যে রিসেন্টলি কিন্তু ড্যাডোর সাথে BEAWorld এর একটা মেমোরেন্ডাম অফ আন্ডারস্ট্যান্ডিং হয়েছে। তো আমরা কিছু পয়েন্টসে আমরা বা কিছু বিষয়ে আমরা একসাথে কাজ করতে ইন্টারেস্টেড, এবং আমাদের পক্ষ থেকে BEAWorld এর পক্ষ থেকে কি ধরনের পাবলিসিটি বা যে ধরনের কোনো সহযোগিতা লাগে আমরা রেডি আছি। শুধু ড্যাডোর জন্য না, বাংলাদেশের যে কোনো পজিটিভ ইনিশিয়েটিভের সাথে BEAWorld অবশ্যই থাকবে। তো এখন প্রশ্ন যে কেউ করতে পারেন এই বিষয়ে, কারণ এটা অত্যন্ত গুরুত্বপূর্ণ টপিক, বাট অলওয়েজ নেগলেক্টেড। আমরা দেখতে পাচ্ছি ভলিউম প্ল্যানিং হ্যান্ড রেজ করেছেন, আপনি আপনার প্রশ্ন করতে পারেন।
আসসালামু আলাইকুম, গুড আফটারনুন।
সালাউদ্দিন ভাই,
জি আমি বলতে চাচ্ছিলাম, থ্যাংক ইউ রাজর ভাই। ভলিউম প্ল্যানিং অ্যাকচুয়ালি আমার গুগল প্রোফাইলের নাম। মাই নেম ইজ মির সালাউদ্দিন। It's my pleasure to know Dr. Edris yourself. It's a very resourceful and very well in need presentation that you have covered. Unfortunately, I did miss your last presentation, and also I've been seeing your presentation coming. So I was waiting for this event today for at least about a month. I think the last one was about a month ago or so. Again, thank you very much. You might have actually known or seen some of myself or volume VPDL projects we call. I'm based in the UK. I'm actually currently operating 2 business here in UK. So the question I was going to ask you Dr. Idris, you have had a very significant mission and aim to develop and giving the opportunity to the people who are not known the fact is a very imminent threat, whatever their everyday's life, as you mentioned in your presentation. What we hear sometimes we do put ourselves আমাদের ঘুম আসে না, হ্যাঁ, আমাদের কিছু বাঙালি, বাংলাদেশি, ইন্ডিয়ান, পাকিস্তানি কিছু এথনিক পিপল আছে যারা এখন আপনি হয়তো শুনে থাকবেন যে ইউরোপে পাড়ি দেওয়ার জন্য তারা কিন্তু ড্রাউনিং একটা বিগ রিস্ক হিসাবে নিয়ে নেন, ইভেন ইনক্লুডিং ফ্যামিলি সহ নিয়ে নেন, হ্যাঁ, এবং মোস্ট অফ দেম আর ইন সাফারিং ইন দি সি, হ্যাঁ। আপনি রিসেন্ট হাইলাইট নিউজে দেখবেন nearly 5,000 people died in 2025 itself. And what I was going to share you and ask you, when our, I don't know, it's government level or semi-government level, whenever people depart from the country, do they have a certificate of swimming? Do they have any threat, like resilient training that they would be having facing this sort of drowning situation if they take any wrong or unpleasant trip to go somewhere? I don't want to talk about that, what is called the migration pressure or migration sort of things, but people do engage even some activities in a fresh land. There was a incident came apparently known my local area. There's two girls, two sisters from Asia, Bangladesh somewhere, or Pakistan, I don't know, but one gone drowned in a small water channel. It's like আপনার একটা ছোট সাগরের যে পাহাড়ের ফোয়ারা থেকে পানি পড়ছে এবং ওরা মনে করছে এটা তো ডিপ না, হ্যাঁ, কিন্তু they couldn't come back because of the pressure or whatever I read in the Guardian. So my key question to you to share this everyday's risk. People comes from various regions. They don't know the other regions' threats. They do not think in that way. However, we are like educator, you are researcher. Some people are actually our protector. I call they are in control to say, hang on, you can't do this or you won't be able to do this. And if you have a sort of education or training, then okay, that's something that we could say they are actually very safer. What are the measures? The key question is to say, what are the measures that the preventive action can an authority deliver to these high moving people, high risk people?
Thank you very much. I am very much aware about the crossing the Mediterranean Sea and from Africa through the different African countries. Recently even the migration influx is so high in Italy. Government asked in the European Union Parliament, they raised these issues. It's very difficult for them to manage huge number of people every day coming from the Bangladesh government with the IOM, and has some awareness campaign I saw in the news media little bit, but we need actually more actions. And as you said, these people not only certificate, definitely I can answer you, Bangladesh does not have the verification process for the migration or the overseas expert people coming expert. They don't have definitely have take that certificate if they know swimming or not. And I don't think they don't know swimming. They know swimming. Those in particularly the labor migrations, labor drowning in the in the Mediterranean seas, they definitely may know swim. They definitely know, but we have to work on different angle. And if the countries, economy coming better, not depression, not political problems, people would not do that. Until we do not finish that, we have too much poverty. People don't have the safety in the country. Safety, not only life safety. People, most of the times I see people 50 lakh, 15 lakh, 10 lakh, even more they spend. because people face problem there. Income, business, whoever face start something, very difficult to run the, bring the money back. So we need to have the special agenda. The one you talking about, we have to have this one, like the drowning I am saying, then the labor migration and the drowning, unexpected deaths, Bangladeshis. Many times I see the overseas media, Bangladesh coming as a leading, figure always. So for the death around the unexpected death in the migrations through the migration process, it's not good for the Bangladesh reputations. Reputation bring the money. So our outlook, our face, as you see the government face in UAE, because of the reputations. They don't. Our leader here in the country in the UAE don't want to hear Bangladesh because reputation gone very very down to other countries. So Bangladesh has to think about for reputation every day now. Lots. They cannot make money. I always say people saying the Bangladesh becoming investment, this thing, that things, other things. I always think it's a joke. Without making safety, security, without making a good image, they told about the investment coming. Those people in business, they're not mad. They know how to make the money. There may be government incentive something, they're going to take that one. There's a high consultants fee maybe for them. Overseas people going for that, not for the investment, for return. So I think that's if I answer, we need to bring that one as a new, another issues and have to write. And there is a IOM, International Organization of Migration, as you know, very strong platform. They'd be happy to support that kind of initiative. Even someone talk about any research, any public campaign, any national level initiative, IOM would be happy to lead for this kind of initiative. Thank you.
Okay, thank you very much, Professor Dr. Edris. Okay, I request Dr. Habib Khondokar has raised the question. You can ask your question.
Assalamu alaikum. Thank you for your very detailed and very carefully researched presentation. It's really very, very informative. I have 2 points. One is, have you done any comparative research between Bangladesh and a country that fits the environmental and geographical profile of Bangladesh in terms of drowning death? The second comparison that I would be quite interested in, because your research is more than drowning, you do disaster research. So what about comparing drowning death with traffic-related accidental death? Because Bangladesh features very highly in terms of road-related traffic accidents. And I've done some inquiries, and I wrote a paper a long time ago on that, linking corruption with traffic accidents across nations. So that would be interesting, because the kind of effort and research strategies that you have invested in drowning, you could also do that for traffic-related accidents. Would you consider that as a future project? Thank you.
Thank you very much. So we call this is unavoidable death. Avoidable death. We avoidable death. So drowning, traffic accidents, and this is the 2 major things. We have definitely planned for the traffic accidents. We are working on it. We have a database on traffic accident in Bangladesh. As you see, I have a co-author. Jili, are you here still? Jili is a...
Yes, sir.
Yeah, okay. She's a student at the Dhaka University now. She's doing masters at Dhaka University Geography Department. We have more. Jili is one of the member with our traffic accident group. So with my organization at the moment, we have nearly 40 interns from across public universities. We have launched river gut accidents, traffic accidents. We have the drowning, we have the earthquake, we have the drought. So we have separate research group. We didn't do the cyclone. I did personally lots of cyclone research, and it's our research area. And at the moment, less death. As you see, drowning 20,000. The fact is 18,000. Cyclone death is now below 100 last few years, except 2007 Cedar. But still people talking lots about the cyclone. Yes, we have to evacuate, but the more important one, more causing death one, Unfortunately, this same thing we discussed in last session as well, the major operation of the fire service, Shakil. So the most death one, in future earthquake, kind of drowning, traffic accident, is not studied in our public university disaster discipline. I was a public university. I know all of university curriculum inside. Unfortunate, but I'm trying to make something, and we are busy here with our other things. Trying to make some MOU with universities. Dhaka University is in a process with me. As you see, it's not we taking infuser. We already have a traffic accident group. We working, but sometimes it's not paid. It's very difficult to keep students working. We are a little bit slow. Definitely, we'll try another question for the traffic accidents. Regarding the comparative studies with Bangladesh with the similar situation, Bangladesh is called kind of, to be honest, with the WHO and globally, so much researched country. We have lots of research, not exactly in a same size or geography, but in comparatively with the low and medium income countries, Bangladesh has been pilot with the WHO project in last 2-3 years. And Bangladesh also has another organizations. It's called, I would say, doctors lead organizations, medical doctors. This problem them, they never try to bring things in the national media, in like the medical. They don't want the preventative things. They have something little things like the only child care centers, something like that. So and little bit the training for the CPR limited. So we have that organization is world class in kind of research, but nobody heard the name and not impact. They working 20 years. I never see them making any national level seminar, national campaign, bring the leader. And I'm engaging people here because I don't have any financial interest. Sometimes people that they do as a income interest, they think this, the research people also think about it's my agenda. I have to keep it. I have to do it. I'm not doing that way because it's all my giving. I'm full-time employed overseas. I'm full-time job holder, earning good money. I don't need to Bangladesh this kind of things for the earnings. I'm trying to do it. As I said, comparative studies. Bangladesh has been piloted in the many other studies led by other organizations. I haven't done it with the comparative with other countries, but in Australia, I have some connection because I studied in Australia. Some 1-2 professor at the moment, they're trying to learn what happened in Bangladesh, what they can improve. That countries, they always smart. So they are reviewing Bangladesh research paper. My research, when I contacted them for other purpose, they contacted me. They want to do the comparative study with Australia and Bangladesh. They want to learn what they can take from Bangladesh and what Bangladesh can take from Australia. That kind of things happening. Thank you.
Thank you.
আচ্ছা, অনেক ধন্যবাদ প্রফেসর ডক্টর ইদ্রিস। এটা অত্যন্ত গুরুত্বপূর্ণ টপিক এবং যে কোনো ফ্যামিলি যে কেউ এটা যে এফেক্ট হতে পারে। তো আপনাদের কারো যদি কোনো প্রশ্ন থাকে হ্যান্ড রেজ করেন এবং প্রশ্ন করতে পারেন।
Next answer, Jili will respond, our intern. I want Jili talk. Any question for Jili?
Jili, answer for today's topic or traffic management?
No, traffic. Jili can also, as I said to you before, I'm engaging Yan with all of my activities. I will die or I'll not, I cannot do everything alone. So Jili can answer drowning as well. She did some campaign. She is our social media campaign person for the drowning project. So she knows the fact.
Okay, I can ask actually. You already told about the comparative figures between Bangladesh and other countries. So is there in Bangladesh, compared to last 10 years or 15 years, the figures is improving, reducing the figures, the number of accidents, or it is increasing? And what is the preventative actions from the government?
I think I should answer that questions.
Yeah.
Really? Okay, I'm taking
Yes,
it. Okay,
sir.
Lily? Yeah.
Okay, sir.
Yeah. Because in data times and the policy level, students don't do it, and I know I am doing the data and policy. Bangladesh has a swimming project with the Bangladesh Shishu Academy, with the Ministry of Women and Child and Women Affairs. They have a project for swimming. If you remember anybody during the July revolutions, after that once, people, was making the social media comments about that project. People don't know, understand. They thought the swimming project is unimportant and is a government, the previous government did for the making money. No, that's wrong. Government with the WHO and the other organizations, because swimming is the issues, has taken the swimming project funded by other foreign overseas countries. It's a pilot. It's not a huge. So it's maybe how many? There are a few thousands people will be covered under that project. Our drowning prevention policy is going on. It's working on it. We have a policy drafted, not gazetted yet, I believe. It's underway for the drowning prevention, national water safety plan. And regarding the data, is it increasing or decreasing? Data is always a big issues, because monitoring and accurate cataloging of data, accurate recording, and is really not done systematically. So I would say it's not decreasing, at least. It is not heavily increasing. It's kind of Bangladesh, sometimes little bit progress, sometimes down. And statistically, we would not say nothing significant, in terms of the improvements. It should be a national level agenda. National level more, as I said, should be cross-sectoral with the health policy. We have a big number of the স্বাস্থ্যকর্মী যারা ফ্যামিলিতে যায়, তাদের কাছে জিজ্ঞেস করলে তারা তুমি কোনোদিন জীবনে জিজ্ঞেস করছো কোনো ফ্যামিলিকে ড্রাউনিং সম্পর্কে? They not. That's where we have to give them, train them, award them, capacity building them. Then it will be more cost effective. So that's what I was trying to say in the national media this year if we do something. And from our side, again, we expect the participant from this. There will be some people joining with us. If someone from the UK, from other countries, with our advisor or any other kind of capacity. So we will have more people in our board. Thank you.
আচ্ছা, আপনারা সবাই ওপেন প্রশ্ন করার জন্য? আচ্ছা, প্রশ্ন করার আগে আমি আরেকটা জানতে চাই যে আপনি তো যে ফিগারটা বলছেন যে 26,000 পার ইয়ার ড্রাউনিং ডেথ,
18,000
আসলে এটা হিউজ মনে হচ্ছে আসলে। এটা যে কেউ তো প্যানিক হয়ে যাবে যে এত। তো এটা আমাদের অন্য যে কি বলবো, যে অন্য যে সোর্স অফ অ্যাক্সিডেন্ট, ফর এক্সাম্পল ট্রাফিক বা আদার কম্পেয়ার্ড টু আদার রিজনস, সো ডু ইউ হ্যাভ এনি ডাটা দ্যাট traffic accident, how many?
I was reading Khandekar Habib Khandekar also might answer. I reading traffic accident data is also not much accurately recorded. I sometimes send the students or volunteer to collect data. Government is not government officer is not supportive. And as I know, many of this data, they don't keep 2-3 years. They remove, they destroy the data of this kind of death. Traffic accident annually, definitely in the national media or some sources, I see 10,000-12,000 in a year. But I believe it's more. In terms of the number, it could be underestimated. We say underreported at the moment. But at the moment, I see the figure in a year, 10,000-12,000, something like this.
So that means the child drowning number of accidents or death is more than traffic accident.
Traffic accident.
Okay, I believe this today's session will be very useful, and basically it is awareness.
Yes, it's awareness. Awareness.
তো আমরা আশা করব ডক্টর এদ্রিস এই ধরনের সেশন আমরা আরো নেব, যেটা এই ধরনের জনগুরুত্বপূর্ণ সম্পর্কে। এবং মোস্ট অফ দ্য পিপল আসলে আমরা বেশি ব্যস্ত থাকি আমাদের ওন প্রফেশনাল কারিকুলামের উপর। এই ধরনের টপিক তো ন্যাশনালি ইম্পর্টেন্ট এবং এটা বেশি দরকার আসলে। তো তো আরো কারো যদি কোনো প্রশ্ন থাকে আমরা সেশন শেষের দিকে যেতে পারি। আমার মনে হচ্ছে যে কারো কোনো প্রশ্ন নাই। তো ডক্টর হাবিব খন্দকার, আপনি কি কনক্লুসিভ যদি স্টেটমেন্ট দিতেন?
No, I just wanted to mention one point. Professor Edris is right that the government estimate is around 12,000, 9 to 12,000 traffic deaths, but some unofficial non-governmental body did a survey, I forget which institution, and their estimate is 24,000 traffic-related deaths in Bangladesh each year. So 24,000 is more realistic. And I think that has kind of avoided national attention. Every day, if you simply go through newspapers, you would see how many people die and celebrities die. It's such a national tragedy, and it has been neglected. So at some point, I think we should be more aware of such avoidable deaths, and we should do more. And Professor Idris pointed out that many false allegations were made about projects like swimming project, and I know there was a project on autistic children. It was a very, very vibrant, active project, and that was completely maligned. It was given absolutely false accusations in the last 18 months, and I was shocked to see that. So things happen in Bangladesh which are extremely unfortunate, and people don't get credit for the good work they do. And I really congratulate both Professor Idris and his assistant Jilly. I couldn't hear her for the commendable work that they're doing. Thank you so much. And we hope, more such work will come out and create more awareness. Thank you so much. Good night.
Thank you very much again, Dr. Habib Khondokar, for sharing your valuable points. And we hope that this kind of session will take regularly to increase the awareness among the people. Okay, as we bring this insightful session to a close, I would like to express our sincere gratitude to our esteemed speaker for sharing your valuable knowledge on one of the most important topic in Bangladesh and worldwide. And your experiences on this crucial topic, your dedication to child safety and drowning prevention is truly inspiring. Okay. I also thank each and every participant for your attentive presence and interactive session and thoughtful engagement. Your awareness and willingness to learn are the first step toward meaningful change. Please stay connected with BEAWorld for future sessions for equally important topics. You know that BEAWorld conducts session every week, Saturday, same time. So until next time, take care and stay safe. Khuda Hafiz to everybody. Goodbye and good night.